Calling this meeting of the South Bend, the St. Joseph County Public Library Board meeting to order. October 20th at 4:42 p.m. Take the roll call. Ms. Richards? Here. Mr. Rensberger?
Here.
Ms. Poppet Randall?
Here.
Dr. Curtis?
Here.
Mr. Feldbaum?
Here.
Dr. Garcia?
Here.
And I am here, Dr. Warren. Consent agenda. We have the library board minutes, declaration of excess with John library materials, personnel changes, bill list, gifts and grants. Do I have a motion to approve the consent agenda?
I would like to motion to approve the consent agenda.
So, any questions or discussion? All in favor, say aye.
Aye.
Aye, opposed? Motion carries. Director's report, Ms. Murphy.
Thank you. We have walls going up at LaSalle, which is very exciting, and they're full permit in place. And then on our Western project, we have a recommendation to award that bid, which is on our agenda for a little bit later. We've been bringing all the second grade students in for tours of their local branch. And they get a book while they're there, a little lesson on how to find things in the library and have a STEAM and story activity. That's been fun. Each branch hosts 2 signature events a year. I've attended a couple of those in the last month or so. One was the Hispanic Heritage Month at Western, and the other was Tut'aween over at Tut. So both of those events had full parking lots, people all over the place doing all the different activities. So that was a lot of fun. We are ending our subscription to edX, which includes study.com and unfortunately Bendable. We were looking at cost per use in our databases. This was not a sustainable one. Bendable has also been bought out by a couple of different people. I do think on some level it is with Baker and Taylor now too, but it's almost impossible to find the links to our local content anymore. So
I was a big fan.
I was a big fan
And
too.
I began to see this
Yeah,
degrading of the.
yeah. So they
you
sold.
know,
And then they sold, and now everything is just buried in there, so we did not find it to be valuable to continue with, but we are rolling out BiblioBoard, which is a platform for creators, so musicians in Studio 304, writers, you can self-publish on there, you have the opportunity to possibly be seen by Kirkus Reviews if you self-publish on there. So we're hopeful that that will be a really beneficial platform for our patrons. Expect to see that after the first of the year. Baker and Taylor, a book vendor for libraries since 1828. And now,
200 years.
yep,
So.
they are going out of business by the end of the year. They had an acquisition planned that got pulled at the very last minute. So they were being acquired by some other company that decided not to do that. They've been clearly having some trouble the last couple of years. So Dave Height, our collections manager, has slowly been moving us over to Ingram and some other vendors. So will it impact us? Yes, but not to the degree that it's impacting libraries that use Baker and Taylor exclusively, or even as a primary. So 5 years ago, that would have been us. So kudos to Dave for staying on top of things and making sure we don't get caught up in Baker and Taylor's mess here. But we do expect it will impact supply chain for libraries just in general. Joe Geprick, our facilities senior manager, was selected by the Indiana Library Federation as Outstanding Staff Member of the Year. He'll receive that award next month. I mean, Joe is just a phenomenal facilities manager, and I think that's a group of staff members that typically get overlooked by these type of awards. And I thought it was important to highlight their work. So we nominated him. Not only did I nominate him, Karen as his supervisor nominated him, Rana did, and then all of the branch managers got together and wrote a letter of support. Because not only is he just good at the facility side, he's really good at the relationship side. And the branch managers and customer service here really trust him. So, and I trust his recommendations, like that is, for somebody who doesn't understand how everything works, to have a facilities guy that can explain it in a way that I understand it is huge. So I'm proud of him. I also know that one of our staff members that went to Bloomington to start on her MLIS, and one of our former staff members both got scholarship awards from IOF this year too, so. I just said it's an SJCPL sweep down at the awards banquet. That'll be in a couple weeks. And then we hosted this workshop on marketing collections. We had 23 area libraries come and take that workshop with 63 of their staff members, and then a whole bunch of our staff members too. I can't remember what the number was. So that was a 6-hour workshop on marketing collections. And I popped in for a couple of hours, one in the morning, one in the afternoon. Really interesting, data-driven, retail type of content on marketing the collections. The libraries he's worked with have seen an uptick in circulation of their print collections. So we're working on implementing some of his ideas.
I have I don't even know if this is the place to ask the question, but were we affected by the Amazon Web Services outage today?
Yes, we were.
Yes, because I know that I was supposed to go to a workshop and they said, sorry, no Zoom, no Canvas,
Oh.
no Canva.
Zoom and Venmo and our print system, it knocked out all newspapers, online, and knocked out a lot of our stuff.
I'm sorry, can you repeat what we're saying about this?
Amazon Web Services
Right.
went down today, and so it
Oh,
affected,
Yeah, I did
it affected a lot of our services, so.
Right.
Canvas and grade school. Oh,
Looks
so
like
much
Zoom
of-
is back up, so.
Oh,
Amazon.
it's obviously on, yes, so that's good.
So,
Sure.
Steph, are we seeing problems with supply chain and problems with publishers afraid to publish certain things?
Not yet.
Any other questions? Right, I will take a motion to accept the director's report.
We'll move.
Second.
All in favor of accepting the director's report, please say aye. Aye. Opposed? Motion carries. Next, patron engagement, Ms. Klein.
I have a couple pictures on page 1. One was the Hispanic Heritage Celebration at Western Branch. That was on September 30th. And then Fun with Fire Station number 9, that was at River Park on September 6th. They were both really well attended. And the top titles, again, the Let Them Theory and Kristen Hanna's The Women keeps popping up like every other month. I haven't read the Let Them Theory, but I've been told I should. I'm not sure what that says.
Dogman is a big favorite with my grandchildren, a big favorite.
Oh, yeah. And then page 2, I just wanted to say Tut gate count is still seeing an increase, 24% increase since September of last year. And then unfortunately, the Center Township gate counter was not working for a short time, but it's back up. So the number here might be a little bit lower than it actually was.
It's gonna be a lot lower than it actually
Okay.
was. Yeah, because it was saying 50 people a day and they usually get more like 200. And then we had a couple days that didn't work at all. So
We'll be back on track.
So if we take a look at the library use, I think that's what we're talking about here, total visitors.
Yeah.
So everything seemed to be, like if you go through March, we were right on target with, I guess the yellow line is last year. But since March, it seems like the gate count or the net total visitors is significantly down the last 6 months. Do we have any sense as to kind of what's going on there?
building closures.
So people are not,
Closed.
so people are not using other branches, they're simply not.
Some of them are, some of them aren't, but like our Western door count right now, you're talking about 100 kids a day that aren't, I'm sorry, LaSalle, that aren't coming into LaSalle every day. that has a significant impact on door count. Center, some people did use another branch, and that's what she was talking about with Tut still seeing the benefit of that. But some people just stop using when you close a building like that.
Then on page 3, I just wanted to point out that while Francis Branch saw a 25% increase last year at this time in September, there were some days that were shortened due to HVAC issues. I had a note in the spreadsheet from that. And then on page 5, I just wanted to point out some of the study room uses. So there are 1,068 times study rooms were used, and then I just have a breakdown here. And there was an increase even without adding in Center Township's 2 new study rooms. Yeah, and Maine has 13 study rooms. Center now has 3. One serves 7 people and one can have 2 people, and then Western has 2 study rooms, and Youth Services has 2 study.
Any questions? All right, the next financial report.
You'll see the fund report. If there's any questions, let me know. One thing I'll point out for the appropriations report, so we did the wire transfer and everything for the bond. We will get our bond funds for the Western Branch renovation on the 23rd, which means that we will then be able to pay back the operating fund with the one line for the engineering and architectural services. We'll be able to pay the operating fund back once we get our Western bond dollars. So really in general, other than, and we have a little bit of tariff dollars that we've come across so far. It hasn't been too bad, but we have a little bit of tariff dollars that have been coming through. We're just kind of tracking that to see how much impact. So far, 2025, not that much impact. And so everything else is pretty much in line. We're exactly where I would expect us to be at this point during the year. And then a few other things that we are doing in my office are the audit is complete, and thank you, Ruth, for attending the audit exit interview. We had one audit note regarding how we recorded the interest for Trust Indiana. We knew when we got Trust Indiana at first how we were setting it up. We had to do some consultation, but as we got through to the end of the year, we were not really setting it up correctly. So we already had fixed it, and we knew that we would probably have an audit conversation about that. So we have one note that it was understated in one year and overstated in the next, but it's now clear. So we should not have that audit note again. So nothing other than that, no surprises at all. They were very quick to get done. I think that my team gave them their information very quickly, they really did not have any questions for us. We got them exactly what they needed when they needed it.
I would think your credibility and your group's credibility have risen immensely, and so you're probably, they expect good and they get it.
Was this the state audit you're talking about?
This is the SBOA, yes, this is the state audit. We have it every other year, so we will not have this audit again next year. We'll have a 1-year gap. So we have not had any other information for the county component unit audit. We do have that every year. I'm assuming that it's fine. We've had no questions. They didn't even ask us to come to the exit interview. So I think we are fine with that. Let's see, we actually last week we had training. We trained over 34 staff on our new purchasing and accounting software. Most of the staff will be using, we are getting rid of our old purchasing requisition software, and we are going to a new integrated software for my team for the accounting part, and then purchase orders. So they were trained over 3 days last week. We are on our implementation right now. So we will be up and running on November 3rd. And at the November meeting, you will see new reports. So they will look a little different. Hopefully they are cleaner. I don't know if you all remember, we had some reports before that had no commas in them because the software didn't have commas. We had moved everything to Excel, so it would make it a little bit different, which we were basically doing double work. So we would print the reports, we would have to add the information so that you all could see a nice report with commas. But these reports now have commas in them, which is a big thing for us. But we'll also be able to go paperless, right? So we'll be scanning a lot more and pulling all of that information in. It will help our audits out better. We can, we'll be able to have the auditors go into the software and pull what they want to pull. We already just, it's all a virtual audit anyway, so we're pulling the paper to scan it to give it to them. So I think that it'll be a lot of efficiencies on our end and also with the staff. And then also senior leadership will also be able to see better reports. They will be able to go in there, look at their budgets on their own and kind of do some things that we give them rights to do in the software. So I'm super excited. My team is also excited about that.
I'm so excited about the comments.
She is excited. Talking to me about comments, and they are sorry.
You print the report and you have to go in there and you have to put in your comments
Yeah.
by hand so you can see.
Somewhere there's a programmer should be looking for a job.
Yeah. I'm sure. And really the software was bought by our former software. So we're really, in a way, we're not changing software companies. So our support staff will be the same. So I'm excited about it because I really do like them and they understand the nuances that were already here before I got here and then the changes that I made. So they've been really great so far. And then just to give you a little Trust Indiana information, our interest rate is 4.2884% right now, and we are continuing to move along happily with Trust Indiana. Any comments?
Could you say a little bit more about tariff dollars?
Sure. So it looks like that we have had a few purchases that may have been foreign purchases because of what it just happened to be. And so there are a few companies that are breaking out on the invoice and saying, this is how much you've got to pay us extra for tariff. We have a couple situations where FedEx or UPS have called us and said, you can't pick this up until you pay this additional tariff dollar. So we are seeing it. It's not hugely impactful yet, but we are starting to see it on some invoices. So that's why I decided to split it out and track it. It'd just be a little bit easier for me to see. We just basically move some of the freight dollars into a tariff line from an appropriations perspective, but that's what that tariff dollar is, yeah.
Okay, thank you. Any other questions? I will take a motion to accept the patron engagement report and the financial report.
So moved.
Second.
It's been moved and seconded. Oh, sorry, you got that. It's been moved and seconded that we accept the patron engagement report and the financial report. All in favor, say aye. Aye. Opposed? Motion passes. Any unfinished business? No? All right, going on to new business, we have the big one, the budget adoption.
So last meeting in September, we did the public meeting. And so my request is of the board to approve the budget as it is stated.
So moved.
Second.
It's been moved and seconded to approve adopt, thank you, the 2026 budget. All in favor, say aye.
Aye.
Opposed? There you have it.
My fourth budget,
It's great.
the first time, but
Did I do the first one? Did you just start?
I think, yeah.
Anyway,
Yeah.
Anjanette and I are in it together. No, actually, it's great because I love having Anjanette do the budget. I can just look at it.
Well, except when you have to put in comments.
I don't have to put in comments.
All right. Thank you for all your work. Appreciate it. All right, next we have the health insurance renewal.
Hi, so I provided all of the changes that we are proposing for this upcoming year. After our open enrollment period, I have Patrick Harpenow from Gibson here to update you all on his executive summary, which he provided in the packet. Sure.
Good afternoon. All right, so Kara provided the executive summary I put together. I'm gonna hit just the highlights, but please stop me, ask questions. If I use an acronym that doesn't make sense, let me know and I'll explain it. So, overall, from a financial perspective, the original projection, assuming no changes, was about a 2.9% decrease, to the budget. Obviously, the library is self-insured, so we're using, historic data, we're trending it forward. But obviously the budget can go up or down based on, claims being a big driver of that. With the proposed changes, we're calling for about a 7.4% reduction, to the budget for 2026. So, all in all, really positive from a financial aspect. The plan, continues to run well. The changes we've made the last couple of years are panning out to benefit not only the library from a budget standpoint, but I believe also the membership and their experience overall. So, that's the financial piece, high level overview. Any questions on that piece?
How in the world did that happen?
Great work from the team and our partnership and a little bit of luck. A lot of luck. No, it's, in all seriousness, the discount, so we made the move to the Anthem network. That is proven to, actually perform better than we originally predicted. When you look at bill charges, so, you go have a healthcare service rendered, the facility or the physician group bills it, and then it goes through the network, which is Anthem, and they apply a discount off of bill charges. The discount that we're getting through Anthem is, beating the previous network discount on average by about a little over 15%. So naturally, we're paying about 15% less on claims than we were previously. The other thing is we had some large claims activity that's fallen off. Obviously, we purchased healthcare for a reason, to protect our people, and, provide that benefit. So we've had some, higher cost claims activity, drop, which is obviously helping the budget projection.
It's really good news. Thank you. Anybody have any questions?
I've been watching these things for a number of years now. And the claim rate, the experience within this group has been pretty much a carrier's dream, I think. Pretty healthy people. I came out of an environment of a nightmare for health. Felt back. And so it's great to work with someone, they have a partnership that works and recognizes, and we get the benefit. That's good.
Yeah, it's, I don't get to stand up in front of, all groups and deliver good news like this, so, yeah, thankful. All right, so one of the components of the health insurance program is stop loss. So that's the insurance product we buy to cap the library's liability. We were able to get that negotiated to an 8.4% increase on that portion of the premium, which compared to benchmark and the stop loss market, in a really good spot there. Just as a reminder, the contract that we put in place 3 years ago, coming on our third renewal, has some contract language that protects the liability, the library against additional exposure liability. So we have rate caps, and then we have what's called a no new laser, which basically prevents the stop loss carrier from isolating a singular individual and applying a higher deductible on that member that the library would be responsible to pay. So just, again, we've had it in place the last couple of years. Just a reminder, that'll continue in 2026. We are making the recommendation to move to the third-party administrator from Allied, who I recognize has been a long-time partner, but moving that to Anthem. The last couple of years, we've experienced some hiccups with Allied that don't seem to be resolving themselves. And given we're renting Anthem's network today, having them administer their own claims that they're processing, just it makes sense, and it'll provide a better administrative experience for sure. Not what I believe to be a better admin or member experience when using the healthcare system. The other thing is Allied has to charge a 2.5% network shared savings fee. So they're taking 2.5% of the network share discount savings. That will go away and move into Anthem, so that'll provide some additional savings to the library. And then the pharmacy benefit manager, so the entity that manages the pharmacy program, which is Carelon. Recommendations to keep Carelon in place. Carelon is owned by Anthem or Elevance Health. We're actually gonna get some enhanced contract terms and conditions and pricing by having that under the Anthem pharmacy benefit contract versus the Allied. So again, just another enhancement, but no changes to the member side. Questions on that piece? Okay, the flexible spending account, or for short FSA, recommendations to stay with iSolved as our vendor, keeping the both FSA accounts active for members in 26. On the plan design and the employee contributions, given the projected budget, recommendation is to hold flat the employee monthly contributions. Which again, is great. We don't get to say that very often.
I don't think many people are hearing that.
Yeah, so just really positive. On top of it, the library offers a very rich benefits program, so that's great news to be able to do that. From a plan design standpoint, there are two changes we're recommending. The first being offering a copay instead of deductible and co-insurance for urgent care utilization. So today, if a member uses urgent care, which we would prefer they use urgent care over the emergency room when appropriate, they go in and they pay whatever the urgent care bill. So for the $150, they pay the $150, which goes towards their deductible. We are recommending making that a flat $65 copay, encourage utilization. It provides a better benefit to members and it actually saves the library money when you run this through the analytics tool. So that's logic for the recommendation there.
Seems like that would be an education piece, though, that no matter what the financial impact is, you know, some people might just have their idea is I gotta go to the emergency room, so there has to be some education there.
Absolutely, I agree with you. I will say, and I know Terry understands this deeply, is that our members, our people who are signed up for our plan, they do not typically go straight to the emergency room like a lot of other places that happens. I've worked places where you have to say, no, don't go to the emergency room because you have the sniffles. That's a terrible idea. We do not have that problem here, thank goodness. More than anything, what I hear and what I see from a claims perspective is that people will either wait and something will get worse to go to their PCP, or people will pay more than they want to, and then I hear about it. That, why does this cost so much? It should be, my doctor doesn't work on Saturday, that shouldn't be my fault. So yes, I agree, we should educate that this is now a possibility. Thank goodness it is not nearly the problem of people going to the emergency room as one might think it would be.
I would agree with all that, especially given your plan design, because you have such a low deductible. Typically in that environment, we see ER because people hit their $500 deductible, and then it's kind of a unlimited credit card a little bit. So yeah, your members use healthcare wisely, which is awesome. And this should hopefully continue to encourage that.
I have a quick question,
Sure.
which I'm sure the answer is yes. The employees are very happy with their healthcare.
Yes, I will say, newer employees are typically more happy with their healthcare than employees who have been here forever, because they haven't experienced something else recently. But yes, employees are happy with their healthcare. And people were, I think, a little bit nervous about the network switch, but then I haven't heard a peep about it, which means everyone loves it, when it comes to this type of thing, so.
One more question.
Mhm.
And more for you. There's a prescription plan through Anthem.
It is, it's Carelon is the provider, but Anthem owns them, is that correct?
Correct, yep.
Um. Is Anthem, I'm just asking is that I have the Anthem prescription plan,
Yeah.
and we were just informed that they're not gonna carry it anymore after January, the IU employees. So I've gotta go find a new prescription plan.
That might be an IU
So-
choice.
Yeah, they may
Is
have
that an
decided.
IU choice?
It was through our IU retirement plan, so I got the letter saying that they're no longer providing prescription through the Anthem network, so I gotta go find them. That's one make sure the Anthem doesn't put it right underneath us.
The plan that I have as part of Medicare, Anthem's just dropped out of it too. Yeah, so I'm looking for a place.
So I'm just worried about.
They should
Maybe they're
chat
not, maybe
after.
they're not providing any Medicare supplement plans any further.
Medicare, some of the plan I still have, it's a prescription plan, they discontinued.
But the Part D Anthem plans,
Talking about the IU one.
yeah.
Yeah, the IU would have, made that decision to partner with somebody else or they're funding, IU funds, they're similar library, they're self-funded. So they're, funding the retirement plan. And so that would have been a change recommended by, IU or their broker, whoever.
When I
managed.
called IU, they said, go find a new plan. I'm like, really? So, yeah.
I have no concerns over the group health plan. They will not be, getting out of. If you look at what Elevance who owns Anthem, they put a lot of money into pharmacy and a lot of different pharmacies, so.
It was very strange to me.
Yeah.
Get this letter to say, they're gone as of January first. I'm like, wow.
Yeah, yeah, it's frustrating and unfortunate, but for this plan, I don't think it. Well, I know we won't face that, at least anytime soon. Sure. The only other plan, recommendation in moving to Anthem, they won't be able to administer the EPC style plan. We do have 2 members on that, that will migrate, to the singular plan. And, we have a plan of action in place for those 2 members to make sure they, have a smooth, good experience. So,
What's ACP?
Affordable Care Plan. If you look on the memo, I put a little more information than what he had put. You would explain.
yeah, so, it's essentially, that plan uses what's called reference-based pricing, so it's reimbursing on a percentage of Medicare, and essentially it created a pharmacy, kind of like a Part D pharmacy supplemental plan, that allows copays that all accumulate towards an out-of-pocket maximum. So, anybody can technically enroll in this, but for individuals that are Medicare eligible, it allows for them to utilize the library's plan and then have Medicare kick in as secondary so that they don't face any balance billing.
Any other questions?
The press, particularly today, for some reason, it's just filled with all sorts of dire news about increasing healthcare costs. Just horrible numbers, and is that baked into what you got now, or are we just delaying the inevitable? How do we fit into all that?
Healthcare costs are going up. A lot of what's hitting the news right now is with regards to the marketplace plans and the significant increase we're seeing in those rates that we haven't historically seen the last 3 to 5 years. A lot of it's being driven by some of this subsidy changes that are likely to occur. I've heard rumors that they may get funded another year into 2027. And so that factoring in with anticipated reduction in marketplace participation, insurance in its simplest form is law of large numbers. So get enough people to buy into the product. That can collect enough premium to offset, the amount of claims that you have to pay out and still have margin for profit. And so, I think that's the big driver right now. We are seeing healthcare costs, so in terms of trend is the highest it's been in 15 years. And that's just a pure function of, some innovation, some catch up from utilization being down a few years ago. And, I think it's just kind of the compound effect. You know, what surgery that used to cost 30,000 5 years ago, it costs 50,000 now.
I will also say this is not what I'm hearing from other library directors. We're an anomaly.
A good anomaly.
Yeah.
So we are taking your claims experience, we're using 33 months of claims. And then we're actually applying trend to your claims. And trending it forward through the rest of 25 and then all of 2026. And we put a little bit of a claims fluctuation margin in there.
Do you all know what marketplace is? Okay, just want to make sure that. Understood the difference.
Good answer.
So, yeah, again, anything can happen, but we believe using historic data, we're sitting in a pretty good spot. Not say it can't change though.
So the memo said that the Affordable Care Plan, which is essentially the library's Medicare supplement plan for those who are eligible for Medicare, has been eliminated or will be eliminated because Anthem doesn't offer this option. So what are those folks doing? What do we have? I think something said we had 2 people in that category.
People.
So what do
Plan
they do?
is to basically grandfather their premiums. That they're currently paying, which are a lot lower than the PPO plan premiums. And offer them the option of moving to the PPO plan with those reduced premium rates. So that there isn't an additional premium cost.
So we're gonna make up the difference?
Yeah.
And that's not a significant.
Not for 2 people.
Not for 2 people.
No. We were talking 50 people, maybe, yes, but 2.
Okay,
Good questions. And then just to wrap this up, so what we refer to in the summary, executive summary, ancillary benefits, so that's our life insurance, our disability, dental, vision, our recommendations to renew all those lines with Mutual of Omaha that we moved to this year. And we've had a positive experience both administratively and on the member side. The only line that is calling for an increase is the dental insurance, which is 5%. And all the other lines are the current premium staying flat on a regular.
awfully good news.
Yeah.
Thank you, Patrick.
Yeah.
Any other questions?
Yeah.
Okay, so I would entertain a motion to approve the health insurance renewal.
Second.
Been moved and seconded. All in favor, say aye. Aye. Opposed? Okay, health insurance renewal is passed. There you go.
Thank you.
You're welcome. Next, circulation policy. Ms. Plummer.
So each year we take a look at circulation policies just to see where we need to do any updates or changes. And this year we recommend that the board approve the following circulation policy updates to be implemented in January. The following sections were consolidated for clarity. 5.1 library cards. It spells out the 3 types of cards offered. And then 5.1.1 library taxing district is now under qualifications, which is 5.1.2. And then 5.1, the old 5.1.2 guest card qualifications is now under card limitations, 5.1.1. And 5.1.3 library card medal is now under qualifications 5.1.2. And you all have a copy of the updates. And a few other things we added under the appendix B at $1 per sheet charge for the 8x11 basswood sheets. That's for the carving laser cutter. That's under service charges. And then the renovated LaSalle branch will include in-house circulating art kits, and that's been added to the library card rules. And then a seed library was added to library card rules. So that's something we tried out this year and we want to continue it system. Yeah.
So the language, none of that language changed, you just moved things around.
We moved things around, but we also kind of simplified our library card types to the 3 types, the resident, access, and guest card. I think on our end, it was more complex than it needed to be, so we're trying to
So you
simplify.
mentioned that we got a copy of the newer language, but I don't see, that appendix D you're talking about or something?
Appendix C is at the end of it. It's a chart, a table that looks like this. Is it happening?
I don't,
It's at the very end of the circulation policies document.
okay.
No.
Start that.
What? It's
I don't-
on the-
Oh, yeah, is it this? No, I don't. think
No,
we
it's
got-
missing from the packet.
Oh,
Yeah.
I'm sorry.
We can table or bring it back next month.
Okay.
And when you do those things, I think I've asked that before, can you all like do a black line so we can
Okay.
actually see
From
what
the
the old
original.
one was
Yeah.
and the new one?
You asked me, she didn't know.
Oh. Stephanie, whenever we get something where we're proposing to change, can staff provide us with a
Yeah.
black line, whatever it is?
Sure.
Yeah, and Myra did review these changes for us, and one of the other things I think wasn't mentioned was we pulled the bankruptcy policy. Current policy said we wouldn't discharge with bankruptcy, and we can't do that, is that correct?
There's 2 different types.
2 different types.
Fine. Fee directed to a government entity, not be able to charge that. But there's certain things where you're replacing a book. there's a
Right,
charge for-
which is all we have left,
Can't
yeah.
discharge it.
So, but we'll put that in next month.
Okay, great.
Okay, do we need to move to table?
Do we need to move to table?
Only if the board is not willing to move forward with, they don't know the changes, it might be better to table it unless you're comfortable with telling line by line.
We're not comfortable telling line by line.
I move that we table the circulation policy update until our next meeting.
I second.
Okay, it's been moved and seconded that we table the circulation policy. All in favor, say aye. Aye. Opposed? All right, motion passes.
Then we'll get that red line in there for you.
Okay. Next, award bid for renovation at Western.
Okay, so we had our bid meeting maybe 4.5 weeks ago. We got, I want to say it was 6 bids, but we're recommending accepting the bid for 5.199. Let me start over, 5,199,800 for Majority Builders.
Any questions?
And we've used them for other.
They did our center project.
they
We
did.
were really pleased. Mhm.
Really pleased if you've not been,
Beautiful.
it's beautiful inside, but I'm struck by the playground concept. I mean, logs and stumps, come on,
Mhm.
and the kids love it.
Yeah.
Every time I drive by there, there's kids jumping on. I keep waiting for a suit of some sort.
Well, I will also say that they were a delight to work with too.
I have a question, a statement, something, not against any of this by any means. I talked with that patron that I talked to about the other issue, and she used Center Branch all the time. She was concerned that the big table for people to sit and socialize and go over the newspapers wasn't there, and she just had some different things about the furnishings, and part of it is she doesn't like change, I think. Part of it is, but part of it, I listened to her, and then my husband and I went later that afternoon, and I talked to some people that were there. Some elderly people and I watched and see it, and I was in pain because of my back right now, and I physically got in and out of all the chairs to make sure I could validate what she was or was not saying and things. And it does. One of the points that came out to me when she was talking was, we get all the demographics of who's coming and how many patrons. But when you guys are looking at the furnishings and stuff like we're gonna do for LaSalle or like we're gonna do for Western, are you looking at the demographics? Because like those high tables and chairs at center, you're right in the middle of a retirement community. I'm tall and I had a hard time getting in and out of them in any kind of pain. So I could see that being an obstacle to the others. And you have tables and chairs they can sit at, but they're not together so they can socialize like they used to. They're separated. So there's issues like that, that because we don't see the demographics, we just see the numbers. I was just wondering if that could be addressed more
Sure.
clearly
So-
as we go forward.
Sure, so we do try to consider, ability, size,
Right.
age, like we try to look at all of that and we try to have different seating areas that
Right.
will be appropriate for a number of different people. Is everyone gonna like where that lands at the end? No, but
Right.
I'll tell you, Rana does the number of hours this woman puts in to trying to make sure there's something for everybody
Right.
in terms of furniture.
Right.
But thank you for the comment.
Right, the one thing that stood out, I mean, she just doesn't like change, is
Sure.
all I'm gonna say,
Sure.
and that's fine. But the one thing that she pointed out that I thought might be, and I don't use that library every day or anything as she does, so I'm not sure. She said there was that big table in the middle and had a task light on it. She said they would sit there and open their papers and they would socialize. It was kind of in the middle and people would come in and out and they could socialize and stuff. And now that's not there because the tables are off to the side. So she was afraid the seniors were losing their ability to socialize as much. And that can be very depressing and hard on them and change their lifestyle. So she was concerned that.
Yeah, that's interesting because there's a number of
I mean, there's
seating areas.
there's the big
That where
seating
you
area,
can sit
right?
and socialize. by
But
the
they can't lay the
fireplace
papers
and the
out, they
wind-
have to hold them. And so
Yeah.
I'm not against what you guys did, because I like it, and I sat in the chairs myself, and if you were
Sure.
real short, the chairs are a little deep. So if you were real short, it might be hard to get in and out of them. But I was in pain and I could get in and out of all of them, the tall ones and the short ones, so I just,
Yeah.
but it just, some of those concepts that the socialization spots aren't the same, so it might be
Right.
harder for them to get.
They are
you know,
different.
and stuff, so just, I knew you guys had the demographics and I wasn't not trusting you guys, that wasn't
Passing along
something
the
we
com-
had seen.
yeah.
Yeah,
Yeah, thank you. So, yeah, we try real hard to accommodate
Right.
all different kinds of needs.
and I saw kids playing in the play area and I saw people walking the path and I talked to an old man who was using a walker cane thing and it was his first time back. And he was really liking the colors and the design and he liked the chairs. He just was upset because where they had his favorite books, they're now moved and he was having a hard time finding them, but the librarian helped him and now he knew where they were and he was set. So it just, I just thought it was worth, since we're going into these other projects. I knew you guys probably did it. I wasn't doubting that, and that's what I told her, but I just figured it was worth mentioning.
Thank you.
Any other questions? All right, can I have a motion to accept the award bid for renovation at Western?
So,
Second,
Moved and seconded, all in favor say aye.
Aye.
Opposed? Motion passes. Next, change order LaSalle.
LaSalle shelving.
Oh, I'm sorry, yes, LaSalle shelving package. Just moving right along. Go ahead, Ron.
We recommend approval of the LaSalle branch shelving package not to exceed $194,122.02. The package was developed by Office Interiors in collaboration with Aurora Storage Products. And I think this did make the package, the quote. It's 16 pages long.
Yes,
It's very.
every show.
Yes.
The amount of time, again, that Ron and Lisa put into figuring out exactly what shelving we needed at the new LaSalle is really
It's
pretty,
very impressive.
very
Yeah.
detail oriented, very, very impressive.
Why did they spell juvenile wrong? Just wondering.
Okay, any questions? All right, can we have a motion to accept the LaSalle shelving package?
So,
Moved and seconded. We have a motion to accept the LaSalle shelving package. Everyone in favor, say aye. Aye. Opposed? Motion passes. Next, change order LaSalle.
So I think we have a pretty comprehensive change order here. It probably won't be our last, but it covers most of our basic, we did the early demo pack. No, we did not. But we got the demo permit before we got the full building permit, so we were able to find some of the issues that you hold your reserve for, what's it called? Contingency, there's the word. So, you see the list here, the total change order is $83,832.60. Couple deducts in there, but mostly adds, well within our budget.
Any questions? Motion to approve the change order for LaSalle.
So move.
Second.
It's been moved and seconded. All in favor, say aye.
Aye.
Opposed? Change order passes. Any other business? Do we have anyone signed up for hearing of visitors? Nope. Okay, the next library board meeting date is November 24th. In the Community Learning Center, second floor, right here where we are right now, at 4:15. Any other questions or comments from the board? Could I have a motion to adjourn?
So moved.
Second.
Adjourning, say aye. Aye. Opposed? The meeting is adjourned.
Thank you, everyone. That was a long.